I was not sure if I should make another monthly update video because the content more or less becoming the same. But then I realized that how desperate I was to know the progress and the path to recovery when I first learned about my upcoming surgery. Even today I follow others to see how everyone else is doing. So this video is for those who are in the same journey like me and want to know more about my 3 months update. Before giving the update, I should clarify one thing. As I said in the earlier video, I had mostly positive experience and journey to recovery for me was easier than I imagined because the information I got from the internet really made me scared at first. That doesn't mean the journey was painless, but given the type of surgery I had and the benefit I am expecting from it, the pain and the discomfort was not something I felt worth mentioning. Just wanted to keep the bigger picture in front of me instead of small daily challenges which I know is temporary. Now, what are the recent updates from my 3 months mark? Mostly all are going well, but there are some challenges I am getting and few I am little bit concerned about. So let's talk about the progress. So I started running again and I got my clearance from my cardiologist, but I must watch my maximum heart rate, which should not exceed 140 beats per minute. Some psychological challenges are still going on and I feel hopeless at many times of the day. So I thought taking some challenges and accomplishing it would be a way to boost my confidence. So I decided to start running to feel myself back to normal again. But trust me, I understand the risk and I am doing it very cautiously and keep checking my heart rate. Maintaining a 140 heart rate should be okay on a flat surface with running slow, good posture and breathing properly. But here ground is not flat, so I'm having some difficulty there.
Above range, current heart rate.
The last weekend I ran 5 miles with a little bit walking in between. I'm going for a run 3 days a week and also going 3 days in the cardiac rehab for an hour exercise. And over there I'm pushing my best because that would be the safest place to test my limit. But they won't allow me to run there on the treadmill, which would be really good for me to feel safe while running. One thing I haven't done yet is the push-ups. The doctor said is that after 2 months I could start, but not done yet. Maybe I should do it now since I'm making the video. Let's do it. Six, 7, 8, 9, 10, 11, 12, 13, 14, 15. So I did 15 push-ups. So yes, in 3 months your upper body should be strong enough to do push-ups. In fact, after 2 months you can do it, but I waited for 3 months. I feel much more normal and I don't have many physical limitation. There are nothing I can remember which I'm not able to do nowadays. Oh yeah, I feel some pain here when I push 2 hands together or pushing down like using the grinder. I had some pain in the middle of the chest while coughing until 2 weeks back, but it seems to be all gone in last few days. I have some pain here, particularly this location on the left side, which comes and goes. It's not like a muscle stiffness, but it is improving slowly. The challenges I am concerned about is the numbness I have around the incision area. and also the leg, inside the thigh and outside of the lower part, and that is not improving at all. In my left side, starting from here all the way to the top, is very numb, very little sensation. And when I asked my surgeon, he said is that it's because of the nerve damage, and it should take some time to grow the nerve back, maybe a year. The pain and the numbness probably was there from the beginning, but I never felt it the first month because I never touched my skin at that time, and also was taking nerve pain related medicines. But suddenly after 1 month I started feeling all different kind of pain, and that is after I stopped taking the abapentin, which is for nerve pain control. Another thing is that if suddenly I make my body straight or stretch my arm, I feel a sharp pulling, kind of like a bit pain here, and it's like a scary feeling. It's kind of like two sides of the skin is peeling off. The cut mark is all recovered, looking much better, but it is very itchy, very sensitive to touch. 3-4 days back, I suddenly got some pain around the left chest hole area. It started beeping, kind of sharp pain, and then the pain become constant for a few minutes. So pain is coming from everywhere around the chest area. It is mostly mild, but no single location. It is hard to tell exactly where from it is coming, inside or outside. I guess pain is fine, but I don't want it to be coming from the heart. But I have no way to tell. So when I asked my doctor, and she said is that taking Tylenol, which is kind of like a mild painkiller, should take care most of it, but I'm not taking it. Pain can come from different places outside the incision, chest tube holes, pericardium inside me, which was cut open during the surgery. So the pericardium is the sac, gives protection to the heart and the big vessels, and also provide the lubrication to reduce the friction between the heart and the surrounding structures. But after surgery, they don't close it, and they cannot close completely, which means that heart does not have the protection it used to. And sometimes blood pressure is also going high for no reason. In cardiac rehab, they asked me to go slow or stop because blood pressure was high in multiple occasions. But after a few minutes of exercise, it's become normal again. And I have no problem with the breathing, and sleeping is also become normal. In the first few weeks, I used to wake up every hour and needed to use the restroom. Then it became 2 hours, and now almost I'm getting a full night's sleep. So my problem is that some kind of pain and discomfort is always there, but not in the same location. And numbness is a problem I am worried about because it is not improving. Since yesterday, I'm getting some kind of heaviness and pressure kind of feeling inside my chest, and this one I am not liking. And something seems to be in the heart this time for sure. Some palpitation, little bit heart burning, and heart rate is also going above 100 even when I'm in bed. Today morning I just started running, and within few seconds both my watch actually started giving me the high heart rate alert. Then I just realized that I stopped taking the carvedilol, which it seems like I no longer needed, which is a beta blocker. So I don't have any more protection for irregular heart rate or AFib, atrial fibrillation, which I had in the hospital. I need to tell my doctor about it. Maybe I should stop running for a while. One more thing is that I'm zoning out, has less concentration and forgetting a lot. And that's why my wife does not trust me with driving. One day I was driving with my wife in the car, and I stopped somewhere in the middle for a few minutes. While waiting there, my eyes got closed, and suddenly I realized that my wife started screaming and actually my car started moving automatically. What happened is that I forgot to um, turn off the engine, and my foot actually lifted from the brake while I fell asleep. And not sure it is just a coincidence or my brain got slow. But I am making a lot of silly mistakes like that, which I was not making before. So this is my 3 months update. Made a lot of progress and still have many challenges. With that, goodbye and take care.